All right, good morning, everyone. Welcome to episode 5 of Wake Up with Walters. Today, we're going to talk about mainly Botox and fillers. So we'll wait a few minutes, let everybody get on, and then we'll start talking and educating about Botox and fillers. Okay, so grab a cup of coffee. I have mine, and we'll spend the next 20-30 minutes really just kind of educating you guys about Botox and fillers. I think it's something that sometimes patients get confused. They come into the office and they say, "Yeah, I'm here for Botox," but really they are asking about fillers and vice versa. So we'll kind of talk about that, do a little bit of education to make sure that everybody gets a little bit better educated on this topic. Okay, wait a few more minutes, let people join, and then we'll kind of give you guys an update on really where we are as far as being able to do medical procedures here in New Orleans. And again, let's do some education. It's something that we do a lot of here, and I think the better that my patients are educated, the better that together we're making decisions to achieve their goals. So let's just wait a few more minutes, and we'll start. We'll start educating. And if you have any questions, just kind of post them in the comments, and we'll try to get to them after. Okay, so let's go ahead and start. So as far as, from the Louisiana Department of Health, there is a mandate for all elective procedures to still be on hold until April 30th. So I think we're expecting any day now for that to potentially be extended. So as of now, the law is basically April 30th, no elective medical procedures or surgical procedures. So that includes Botox and fillers. So, if any provider that is offering these procedures at this time, either in their office or, doing Botox parties, that is illegal. And I would really question the ethics of that provider. It's really not worth kind of risking your health and doing things in an unsafe manner. So today we'll just kind of talk about really kind of the differences between Botox and the difference between fillers. And really I'll just go through with you guys what I talk about every day during an initial consultation for, when someone comes in to see me, they say they want Botox or they want fillers. And there's a lot of teaching involved that we talk about. So I think when someone comes, for Botox, first we try to educate them what actually Botox is. And Botox is a neurotoxin that actually blocks the nerve signals from the nerve to the muscle, and that results in paralysis of the muscle. So there's really three things I say that we do for Botox, with Botox, to the upper third of the face, and that's the most common area. So in between the eyes, the forehead, the crow's feet, those are the most popular areas that we use Botox. And I tell patients that we do three things with that. We can relax lines at rest. We can, we relax lines at rest. We relax lines at movement, and we can help shape the eyebrow. And what I mean by that is there's some muscles of the eyebrow that elevate the eyebrow. And then there's some muscles of the eyebrow that bring the eyebrow down. So if someone's coming and they want to have a medical Botox lift or to get their eyebrows as elevated as possible, then usually what we do is we relax the depressors of the eyebrow and we leave the elevators of the eyebrow intact. So the net effect is that it's a total lift of the eyebrow. So, that's where kind of really the main, most predictable areas of Botox is the upper third of the face. So the forehead, in between the eyes, that's called the glabella, and on the sides of the eyes, called the crow's feet. Those are the most common and I think most predictable. Now, we can use Botox all over. We use Botox to the masseter muscle, so that's the muscle that we kind of chew with, and we do that for a few reasons. Some patients, suffer from jaw clenching or TMJ, and we can relax that masseter muscle and really help with the pain that they experience with that. And then also we use it for jaw slimming. So someone who has prominent masseter muscles, we can target that muscle, relax it, and then produce a nice slimmer jawline. So that's very common. Other areas that are common is the chin. So some women and men, as we age, they may get a little wrinkly chin, and we can put small diluted Botox into that area and really just kind of prevent or create a more youthful chin. And then the other common area is around the lips. Now I'm going to show you in a little bit the anatomy of some muscles, and it's a very common area. However, it has to be done by an expert injector because the muscles around the lips can be variable, and if you hit the wrong muscle, then you can produce some negative consequences to the smile and really to the overall look of your face. And so, what's very common on social media now is the lip flip, and we put small areas. We do small units of Botox to the orbicularis muscle to try to create that perfect pout. It works good, but if done wrong, it can really kind of change the way the smile is. So you have to be very careful in that. And then the other kind of common area is the neck. So the platysmal bands in the neck. You see some doctors doing Botox for that. And, I think for people in their younger 30s, it can work. But really, if you have a lot of platysmal laxity, so if the muscles in the neck, if they're really laxed, then I think it just really doesn't work all that well. And so, really, if you're 45 and older, I think you get some result, but very minimal. At that time, we're usually talking more surgery. Sorry, excuse me. So let's look at the muscles of the face, and I'll show you exactly what we're kind of doing with Botox. So, okay, so here are the muscles of the face, and there's more, but here are some common ones that we target. So if you look, this is the frontalis muscle, and then we have the corrugator and procerus muscles. And so this is a very common area. This is called the glabella region. That's a very common area. And then this is called the crow's feet, and that's a very common area. So, when we treat with Botox, we're actually treating that muscle to really relax that muscle to, again, accomplish three things: relax lines at rest, relax lines with movement, and then help shape the eyebrow. So when you come see me, the way that we kind of group these things in together is by area. So I call the forehead one area, we call the glabella one area, and then we call the crow's feet, which, it's two crow's feet, but that's one area. And usually for each of those areas, it's about 20 units that I feel is needed to accomplish the goal. Now, sometimes in the forehead, I do 10 units. It just depends on, the overall goal that you're looking for, and really what's needed. And so then you can see around the face, here are the muscles that that go towards the lips. And you can see here there's a whole bunch of different muscles, and if you target the wrong muscle, you can really cause some negative consequences to the smile. But here's the orbicularis muscle right here, and so we can put some targeted Botox to that area and cause the lip to evert a little bit and create a little bit better pout. And then there's the mentalis muscle. Sometimes we target this area with the chin, and then this is where the platysmal muscle would be, and sometimes we use that as well. So that's everything that we kind of talk about with Botox. So let's look at really kind of some results, and I'll show you. Here's Allergan's website, and we'll use this website just because they have a really cool feature. So you can see this is a very common complaint. A woman or man will come in and say, I don't like these lines, around my eyes. And so we can do about, 10 units or so of Botox, really targeted to the crow's feet there, and then produce a very nice result where you can see, there's a smoothness of that crow's feet. And so, really effective, very predictable, and something that's very, very popular. Now, you can see this area right here. This is the, most women will, some women after getting Botox, they then come to me and they're like, well, what about this over here? And, that's really your under eye skin. And just like when we sit down, there's a little bit of overlay of skin of the abdomen, and that's the same thing. When we smile, we recruit cheek skin up into the eye, and so there's always some bunching of skin here, and so that's really something that is not truly fixable unless we cut skin out. And someone at this age, I wouldn't recommend really a blepharoplasty at this point, but you can see even with a little bit of smiling, she has a little bit of skin. And really for that, we're talking about, truly under the eye skin, we're talking about other type of modalities, whether it's laser or surgery. And, we can get some smoothness with Botox, but it's really not a full correction to this area. So let's look at, say, the front. So this is the glabella region. This is very common. This is what we call the 11s. And so, some people may come in and say, people are saying that I look angry or I look tired, and, is there something that we can do? And Botox works perfectly for this area. And so, this is, right here where we can target, just like I showed you with those muscles. It's, the corrugator and the procerus muscles. We can utilize Botox and really get a smoothing effect of that area. So you can see here, this is where she has those 11s that are forming with movement, and then when she's still making that motion, it's completely eliminated. Now, this is, you can see once we've treated her with Botox, you really can't see those lines anymore. And this is where I say sometimes Botox can be preventative, because if you're starting to see those lines at rest, so if you're starting to see these 11s at rest, sometimes just with Botox, it doesn't completely get rid of that line. And so I think, sometimes the earlier you start Botox, you prevent that deep line from forming and prevent what I call kind of a tattoo of that line in the skin. Once that line forms, it's more difficult to correct. And we have to talk about, relaxing it with with Botox first, then sometimes talking about filler, talking about skincare, and then even talking about sometimes laser treatments to really kind of resurface that top layer of the skin. So all of this goes hand in hand, and that's something that we always educate patients on. If patients come in for Botox and filler, we start talking to them about skincare. We start talking to them about some other non-surgical options like microneedling and laser, because they all really do a little bit different to really accomplish a lot of the same goal, and that's an overall, youthful look. So, some people ask about men, and basically they'll be like, well, can we look natural in men? And so, again, this is very common in men, the 11s, and this is something that we can really treat and still make very natural. So you can see right there, making that same movement, that those lines are pretty much relaxed and just an overall youthful look. Okay, so that's basically Botox. And again, we can use Botox all over. This is the most common area. This is the most common, very predictable, and you really can get arrested, just more youthful look by using Botox. So, all right, I'm gonna come back. Okay, so let's talk a little bit about filler. So again, remember, Botox helps relax lines at rest, relax lines with movement, and helps shape the eyebrow for the most part. Filler actually fills. So filler can work on lines, but it's actually trying to replace volume. So some providers will say that it lifts. As a surgeon, I don't really think filler lifts. I think filler helps give volume to the area that we're trying to restore. So as we age, gravity wins and things start to get loose. But what we also know about facial aging is that we lose the amount of fat in the certain facial compartments. And so as we lose fat, that causes us to look a little bit more aged, more tired, and overall, just look older. So, a great option, especially for, patients who aren't ready for surgery, is to introduce them to fillers. And the most common filler that we use is a hyaluronic acid type filler. And really that's just a natural substance that's found in the body, that's a precursor to collagen, and really just helps restore the balance to the facial fat loss that we experience as we age. So let's talk about the most common areas for that. Okay, so we're gonna go to Allergan's website here. So you can see this lady. This is a very common patient who comes in and basically, is saying, hey, doctor, I'm looking tired. I'm not ready for surgery yet. I'm just not liking what I see in the mirror. What are some options? And so you can see this is where she's starting to lose fat. And so when we lose fat in the cheeks, there's a few things that start to happen. We lose fat in this middle fat compartment. Then we start to develop a nasolabial fold. We start to develop a tear trough. And then, this is when things start to descend and we start to develop marionette lines and, other signs of aging. So when patients come see me, the thing that I usually talk about is, they may start saying that they don't like this fold. Well, several years ago, that's what we used to do. We used to go and put filler straight here into this fold, but that's not really treating the anatomic cause of facial aging. We're starting to see this fold because we're losing fat in this central fat compartment, this middle fat compartment. So what we tend to do first is to fill the cheeks or that facial fat compartment first. And so when patients come, this patient is in her 50s, and she may talk about she wants this corrected or she doesn't like this line. Well, I try to talk to her and we look at her photos and we say, look, this is what we really need to correct first, because that's the major cause. And the goal is to create a natural look. And, we don't really notice good filler when patients are, in restaurants. We always notice the bad filler. And so, as a surgeon, it's my job to educate and my job to create a natural look for the patient. And so, what we would do here, I would usually recommend at least one syringe of Voluma here into each cheek to help reinflate her cheek to give her a natural result. And so this patient underwent, you can see her here now, and she underwent, let's see what they say. She underwent Voluma, and then she also underwent some filler into the folds as well. So, but this is the major, this is where all the money's at, is right here. And so you can see as we inflated her cheek, she got some improvement on nasolabial fold. She got some improvement of that tear trough without even really treating the tear trough per se. But we filled up that fat pad, gave support back to the cheek, and that's all, with a non-surgical type result. And that's usually attainable. Now, what I tell patients though is, once we get correction like this, she's pretty much at her correction, I feel, almost for non-surgical stuff, because we don't want to create, the pillow face that we see a lot in Hollywood and, on certain, news shows and things like that. And so it's my job as a surgeon to know the limit of what non-surgical things can do. And so let's take a look at a little bit of what I mean by that. So, this is the rise of the pillow face. And so you can see, all different, this is when she was younger and now, look. And of course, they catch these celebrities at bad angles and things like that. But, this is where we don't really want to overfill. And so you can see a lot of these patients and celebrities are overfilled and really don't look natural anymore. And so, that's the goal, where we have to kind of sometimes know the limit of non-surgical and, tell patients when, enough is enough and they need to kind of start thinking about surgery. And you can see, this is what I talked about earlier. You only notice filler when it's bad. And so, overinflated, definitely overinflated, overinflated cheeks and lips. And so, we really kind of, it's our, job as injectors to, restore natural balance and know the limits of, injections. And so then, we start talking about other options once we limit that. And, as a surgeon, that's what I'm excited about, because, really we can kind of see patients in their 20s, all the way through their 70s and even 80s to talk about surgical options at that point. Okay, so let's look at a few more. This kind of shows you another lady, classic aging symptoms, aging face. And so, this is not a youthful cheek. And what we want to try to do for her is restore volume back to her face. And so, again, I don't really feel like filler lifts. That's a debate amongst injectors. I just feel that it restores volume. And so you can see her here, just much more balanced, doesn't look as tired, doesn't look as aged, and, looks overall youthful. Okay, so let's look a little bit. Here's another patient of mine. And so you can see, just here's in the lower face, we were able to fill. These are dynamic lines that are seen. And when, filled appropriately, it doesn't get rid of it 100%, but the goal is to lessen. And so, that's really the goal here. Here's a BOTOX patient. So you can see here in the crow's feet, something that really she was noticing in the mirror and in different pictures. And now with BOTOX, really just a smoothing effect. And then, here's a beautiful patient of mine, and, already, looks good, but is starting to kind of feel, some of the signs of aging. So she's losing a little bit of fat into the cheeks, starting to notice a little bit of the nasolabial fold in the corner of the mouth. And so, with a series of injections and BOTOX and fillers, we can kind of restore that natural S-curve to the cheek, all in a natural manner, to really just give her an overall rejuvenated look. So for her, we did BOTOX to the glabella, the crow's feet. We did Volbella to the lips. We did Voluma to her cheeks, and then we did jawline contouring. So I did BOTOX to her masseter muscle to kind of smooth out that jawline. Okay, so, when is the limit of things? Well, when someone comes like this, in her 60s and stuff, I tell patients there's no really true way that I'm going to be able to get a nice, clean jawline with non-surgical treatments. And so, these are patients that I really start talking about surgery for, because we don't want to create those bad, unnatural look of patients when they're overfilled. So, this patient came and we talked about facelift surgery. And so, here she is, and this is, a facelift to show that jawline that we've created, restored volume to her cheeks with fat transfer, and, really kind of gave her a natural look with surgery. So, we have to know the limits of things. And, if she came to me and said, hey, I just want, maybe 1 or 2 syringes or something, I would have started with the cheeks. But really, she gets, the older that you start doing fillers and non-surgical stuff, the more kind of, less bang for your buck that you get with non-surgical interventions. And so that's why I always talk to patients when I feel like I can get a stunning result with surgery, to give them, not only a drastic result, but one that looks natural. And then same thing here. You can see this patient has, lost some volume, has, a rounder face to begin with. And really, her issue is yes, she is losing volume in the central face, but we want to create a natural look. And so the main thing is we want to really kind of reshape the lower face. And so, here's where with surgery, facelift, we're able to kind of really make that lower face tightened and lifted. And really the only way you can do that is with a facelift. Fillers, it's very hard to kind of correct that just with non-surgical treatments, in my opinion, at the lower third of the face. Okay, so, that's really kind of my talk on fillers and Botox. I think we have a few questions here, so let's see. We'll go to answer a few questions. Okay, how often do I use Botox other than type A due to resistance or antibodies? So, Botox is a brand name. It's the most well-known, the most studied neurotoxin on the market. There are other neurotoxins. It's the one that I use the most. It's, in 6 years of my practice, very rarely do I see some patients who are resistant to it. Sometimes, I can think of maybe 2 or 3 patients. So occasionally we'll then transition them to one of the other Botox or neurotoxin manufacturers. Can you speak to neck wrinkles? So neck wrinkles are tough, and I think that it's very hard for non-surgical modalities to get really stunning results with neck wrinkles. We can put Botox into the platysma. That does sometimes help to kind of tighten the neck. I think it works better if you're in your 30s or early 40s. Above that, I think you get not that much of a result, in my opinion. There's other non-surgical things that we can do, lasers, and microneedling, and skincare. But really, to truly treat, I think neck wrinkles, kind of 40 and above, we got to start talking possible surgery, and that would be a neck lift. Can you get an allergic reaction to filler? Yeah, it's very rare. And so there are some reports of some allergic reactions, but again, very, very rare. I think most of the reactions maybe that you see is sometimes the filler was placed in the wrong place at the wrong level. So it's not really an allergic reaction. It's just a complication of the filler. Again, I think if you see an expert injector, those complications should be minimal. Okay, so how often do I recommend treatments? So, it really depends, but for Botox, as a general rule, Botox usually lasts about 3 to 4 months. And so, I have some patients who, every 3 to 4 months they're coming into the office, and that's right when they're just starting to, see that the Botox is wearing off, and before anything even wears off, they want to get re-injected. And so, that's one type of patient, and I think that's perfectly fine. But we usually do that around every 3 to 4 months. And then there's some patients who kind of, stretch that out a little bit, and they wait to about 5 or 6 months. They wait to see that, the full effect of the Botox has worn off, and then they come back in, and then we do it. But as a general rule, every 3 to 4 months, that's when kind of how long the Botox lasts. As far as filler, it really depends on where we're putting the filler. It depends on the type of filler. So there's several different types of filler based on, the thickness of the filler. I think filler around the lips, that can last anywhere from, say, 4 to 9 months. Fillers in the cheeks can last upwards to two years. I think on average 1 year. We do filler around the jawline, and again maybe 9 months to a year. So it really kind of depends on where we put the filler, and what type of filler it is. Do I do liquid rhinos? Absolutely. So we do liquid rhinos. Again, that is an expert injection technique. If done in inexperienced hands, serious complications can arise, and mainly that's due to the vasculature of the nose. If it's put into the wrong place, you can have something what's called necrosis, and that just means that the tissue of the tip of the nose can die. If placed in the wrong area, there are reports of blindness. So the filler can get into the arterial circulation that supplies the eye, and can block the blood flow to the eye. So, again, rare complications, but it's all the importance that this is a medical procedure, and this should be done in an office setting, and it should be done by an expert provider. I do surgical rhinoplasties, so I feel like the best injectors for liquid rhinos are actual surgeons who are performing surgical rhinoplasty, because we know the limit. And so, really we do that on, I think the best patient for that is a patient who has a slight dorsal hump. So they have a slight little hump on their nose, and we camouflage that with filler. But, we have to be very careful in females that we don't masculinize the nose and make the bridge too large. So it's really a balance, and always should be done by an expert provider. Okay, so if there's no more questions, I think those are things that I talk about routinely every single day when I see patients. And we talk about patients' goals. We talk about the limitations of filler. We talk about the expectations, and we talk about the complications. And I think for most patients, if you're looking to try to correct the signs of aging, we really can't do that in one visit. It's really a series of visits for us to kind of come up with a game plan for you and incorporate both neurotoxins as well as fillers. Lips is something that we can do in one visit and get to full correction. But if we're talking about cheeks and jawline and tear troughs, it really takes us multiple visits to come and see us, so that we kind of stage those injections to make sure that we don't over-inject, and to make sure that we don't get any complications from the fillers. Okay, any more questions? I think that was a good talk. We went for about 30 minutes or so. We're doing virtual consults now. I think, it's very informative. I can see patients, through the virtual consult over, FaceTime or Skype. And we can kind of really recommend a good treatment plan for you. Whether it's BOTOX and fillers and things like that. So if you're interested, just let us know. Our office is open. The phones are open. You can DM me, and we'll be more than happy to kind of, develop a treatment plan for you. Okay. Well, thank you. We'll continue to be doing this while, we're in quarantine. Hopefully it's not too much longer. We have one more question. How often is microneedling needed? So it really depends. We usually, recommend at least a series of 3 to 4 treatments at first, spaced out a few weeks. And, it's something that I tell patients. I think patients who are looking the youngest into their 40s and 50s and are, have some type of regimen, they have some type of year-round regimen where they're doing, Botox, fillers, skin care, and some type of non-surgical treatments. So that's microneedling or lasers. And I think if you have, some type of system where you're doing those treatments a few times a year, that's the closest thing that we have to the fountain of youth, is to kind of, get on a treatment process for that. We understand it's expensive sometimes and things like that, but, it's kind of like, if you just do one of them, you're really limiting, your overall result that can be obtained. It's kind of like, going to the gym and working on your abs every single day, but as you leave the gym, you go get fast food. And so despite, working out so hard in the gym, if you're not eating appropriately, you're really not going to develop that definition. And it's the same thing with non-surgical rejuvenation. If you're doing a lot of, Botox and fillers, but you're not taking care of your skin, you're really limiting the result that we can get for you. Okay. Someone asked, what type of business do I run and where am I located? Well, I'm a plastic surgeon and I'm located in New Orleans, Louisiana. You can go to my profile and see really a lot of what we do, surgery as well as non-surgical stuff. Okay, so I hope that helped. I think we'll be on tomorrow educating and really for the rest of the week. So, leave some comments, send me some DMs if there's things that you want me to talk about, and we will go from there. Okay, we'll see you guys tomorrow.